cat or dog and felt completely happy and relaxed? And did you ever wonder how this really works? I'm Chantal Kaptein, a behavioral biologist, and in this pitch I will introduce you to the horsepower project I'm working on as a PhD and why we use horses as our secret weapon. This horsepower project is an innovative project that scientifically investigates the effects of interactions with horses on military veterans with PTSD. It is a collaboration of the Utrecht University and the Military Mental Health Care Unit. In the Netherlands, there are about 15,000 military veterans that are diagnosed with PTSD. About 20% of them are therapy resistant. This means that despite the fact that they have received therapy, they still experience residual symptoms. This project aims to provide an evidence-based intervention in addition to already existing therapies. Furthermore, it also aims to provide scientific evidence on the effects of interactions with horses on military veterans with PTSD. During the 12-week program, 8 military veterans work in pairs with the same horse. They learn how to brush the horse, how to lead it around, do groundwork with it, and they eventually learn how to ride it. Physiological parameters are measured, such as the stress hormone cortisol, the prosocial hormone oxytocin, and heart rate variability. Validated psychometric questionnaires are used to gain insight into the sleep quality, the quality of life, the physiological health, and PTSD symptoms. Behavioral observations provide information on the interactions between the humans and the horse. All parameters are measured simultaneously in both the horse and the veteran because we're interested into the welfare of both parties. We do not only want to know something about the welfare of the veterans, but also about the horse, because we don't want the horse to suffer from this program. All 8 participants of the pilot study completed the program and experienced it as something positive that aided their reintegration into society. The human-horse interaction can be a metaphor for their experiences in daily life and for their interactions with humans. The preliminary results in the horsepower study seem to indicate that the PTSD symptoms of the participants decrease throughout the study. As one of the participants stated, 12 weeks of horsepower had more effect than years of therapy. Would you like to know more about this study? Follow us on social media or send an email.
Ladies and gentlemen, my name is Laurent Thomas. I'm a military physician in training for the Royal Netherlands Air Force. It's 2007. Our mission in Uruzgan is in full swing. During the Taliban offensive, heavy fighting breaks out, resulting in multiple casualties at both sides. 7 years later, we follow a group of soldiers, most of them veterans by now, each of them branded by the experience they had in Uruzgan. They struggle to fit into society, having to cope with negative thoughts, frequent nightmares, and anxiety. These men and women share one common factor. They have all been diagnosed with PTSD. What I just told you was the plot of a new television series called Thuisfront, or Homefront in English. While the series is an overly dramatized version of the actual happenings, it does shed light on a painful truth. That despite the fact that our healthcare system is one of the best in the world, it does have its limitations regarding the treatment of PTSD. There is a large group of patients who, despite our best efforts, do not sufficiently react to therapy, be that medicine or psychotherapy. Our study is addressed to them and their therapists. In the US, patients suffering from PTSD have been treated successfully for the past 10 years with a so-called stellate ganglion block, to which I will refer as SGB. To this date, over 650 military personnel have been treated with SGB with a 70% success rate. Essentially, SGB is an injection of a local anesthetic in a group of nerves called the stellate ganglion. This ganglion is located in the neck and modulates the sympathetic nervous system. The main role of the sympathetic nervous system is to mobilize the body's resources under stress and to induce the fight or flight response. It is believed that traumatic stress causes this system to malfunction, leaving someone in a constant state of hypervigilance and other associated symptoms. By injecting a small amount of a local anesthetic around the stellate ganglion, the heightened stress response of the body gets a chance to normalize, resulting in immediate relief of symptoms, hereby empowering patients to take back control of their life. The SGB procedure is not a new invention. It has been used safely since the 1920s for the treatment of chronic pain and in the more recent years against hot flashes in patients with breast cancer. It is our aim to validate the exceptional results attained in the US. To achieve this, we are going to treat a small number of patients suffering from PTSD off-label with a stellate ganglion block, thereby putting this technique on the map for the treatment of PTSD also in the Netherlands. Our team consists of an experienced military anesthesiologist, Rolf Brouwer, who is well versed in the SGB procedure. Colonel Erik Vermetten and 2 military surgeons also strengthen our team. For questions, you may contact me on my email, that is l.tamas@mindev.nl. Thank you.
Good afternoon. My name is Captain Graham Downs, and I'm going to be speaking to you today about a piece of work I did during Operation Kubret in Poland, looking at an adoption of an empowered physical training program and the results of that on the rates of musculoskeletal injury. In terms of what we were looking at, we looked at the effects that employing a self-directed PT program would have on the amount of musculoskeletal injuries and the number of days restricted duties that were given out to compensate for those. The empowered physical training program involved troops being tasked to achieve certain exercise routines in their own time, under their own direction, without any formalized group level PT. In terms of the background reasons for carrying out this study, musculoskeletal injury is the most common cause of downgrade and medical discharge within the British Army. As such, it presents a significant issue for the British Army, and it is responsible on us to do everything that we can to keep that risk as low as practicable. Operation Kubret saw 140 personnel deployed to Poland between April and October 2020, and this provided an ideal opportunity to study the effects of the empowered physical training program in this semi-controlled environment. We obtained data from epidemiological data that is recorded as part of an operational tour, and this recorded the number of presentations for musculoskeletal injury, as well as the number of days light duties that were given out. We also obtained data from the soldier conditioning review, our annual fitness test, and we used a home-based squadron as a control for this data. Our results saw that there was a 36.7% lower presentation of musculoskeletal injury in our experimental population compared to our control, and the number of light duties days was 71.5% lower. The initial data obtained from the soldier conditioning review showed similar levels of performance between our population and the control population, but it was impossible to quantify this due to the coarseness of the data that is collected for this test. This brings into mind further work that can be conducted. Ideally, a prospective case control study would be extremely useful in identifying a more clear pattern of causality, as well as controlling for more of the variables that were not possible to control for using the retrospective data that we had access to. I thank you for your time, and I'll take any questions.
Hello, my name is Emmy van Houtert. During the past 4 years, I've had the honor of working on the Veterans PTSD Working Dog Program, or V-Power for short. With V-Power, we focused on the interactions between veterans with PTSD and their service dogs. We did this because an increasing number of veterans with PTSD is helped by a service dog. These veterans highly appreciate the service dog and report that they feel better because of its work. It is, however, still unclear what aspect of the service dog's work causes this appreciation. Is it their learned behaviors, their presence as emotional support, or the support of the organization that trains the service dogs? Currently, we do not know for sure. With V-Power, we try to answer some of these questions though. To this end, we asked if and how the support of a service dog can be measured. Additionally, we asked how the work of a service dog influences their life. For the welfare of both human and animal is important. By now, our studies on the welfare of service dogs have been completed. And our study on the welfare of the veteran is also almost complete. In this study, we compared veterans who had already received a service dog with those who had yet to receive one, and also some veterans without PTSD. We did this via a vast array of measurements. First, we analyzed cortisol levels in saliva. Samples were taken in the morning and evening at regular intervals. Next, we asked veterans to wear a wristband that tracked their activity. We did this to see how many steps they took on a daily basis and to compare their measurements for electrodermal activity. Finally, we asked veterans to fill out a series of questionnaires regarding their welfare. These questionnaires asked about the PTSD-related symptoms they experienced, the quality of their sleep, and how they judged their overall welfare. We did this because measurements of the body cannot always tell us how somebody truly feels. At this moment, all measurements have been completed. My colleagues and I are therefore currently analyzing the results. We expect to present these results later this year, somewhere around September or October. Hopefully, these will help to answer some questions that were mentioned earlier, and also help us to better understand the interaction between veterans with PTSD and their service dogs.
Many combat casualties suffering traumatic amputation, they should not have survived, but they did. And the injuries that they sustained should now mean their lives are dominated by disability, but it's not. The outcomes from 157 UK veteran amputees captured within the ADVANCE study paint a stark picture in comparison to published outcomes from age and prosthetically matched populations elsewhere in the literature. In this PhD study, a collaboration between Imperial College and the Ministry of Defence, this patient group has been identified as an example of human thriving. And so what was it about the rehabilitation process that enabled these outcomes? We're seeking to explore the patient's experiential accounts of recovery in order to understand really what it is within the rehabilitation process that enables the patient to thrive despite experiencing life-changing injuries. In this study, we've captured 24 veteran accounts using a focus group format known as a nominal group technique, and then using a theoretical construct based upon Ryan and Deasy's self-determination theory. We are then interpreting these rehabilitation experiences in order to see how they have met their intrinsic needs to feel competent, to feel connected, and to feel autonomous. And it seems that if that can be achieved, then this is the basis upon which human thriving can then result. So, within these accounts, we also see experiences of decline, and where the experience of rehabilitation undermines a process of recovery. So from this, we then sought to develop a model of what we've called patient thriving, and to use this as an ability as a guide for rehabilitation service design. Accounts of their experience as veterans were then captured, and they were interpreted using this model advanced physical outcome data was also used to verify the qualitative interpretation. And from this, we were able to also present early findings which would suggest that their declared socket fitting issues may well be starting to undermine, particularly in the bilateral amputee, undermine their ability to sustain their exceptional physical outcomes.
Hi, I am Doreen de Groot, clinical psychologist of the Trauma Center of VGZ Drenthe Mental Health Institute. Hereby, I proudly present our team members who will participate in the study. Next, I will introduce the CMAP study to you, MDMA-assisted psychotherapy in cognitive behavioral conjoint therapy. Although evidence-based trauma-focused therapies are effective for patients with post-traumatic stress disorder, PTSD, a significant proportion of patients do not benefit from these therapies. This might even be more true for veterans with PTSD. This highlights the necessity to innovate current trauma-focused treatments. We are preparing a feasible study in the Netherlands with GVZ Drenthe Mental Health Institute, ARC National Psychotrauma Center and Leiden University Medical Center, in which we are going to study a new innovative treatment combining cognitive behavioral conjoint therapy with a non-directive approach, MDMA-assisted psychotherapy. Cognitive behavioral conjoint therapy is a three-phased protocol-based treatment which not only aims to improve PTSD symptoms, but also relationship functioning. Adding MDMA-assisted psychotherapy sessions seems to facilitate the therapeutic process as it reduces fear responses and enhances introspection and interpersonal trust. A first pilot study of Dr. Anne Wagner, Professor Candace Monson and colleagues revealed promising results. MDMA-assisted psychotherapy combined with cognitive behavioral conjoint therapy was feasible, safe, and resulted in a decline of PTSD symptoms and an increase of relationship satisfaction in 6 couples in which one partner was diagnosed with PTSD. The first pilot study will be replicated in Dutch veteran sample with PTSD. Besides the veterans, spouses are participating in this treatment, including in the MDMA-assisted psychotherapy sessions. It is expected that their involvement will have a beneficial effect on treatment outcome. At the start of 2022, 12 couples will be included in this clinical trial. In each couple, one partner is currently diagnosed with PTSD. Both veterans with PTSD and their spouse will receive 15 sessions of cognitive behavioral conjoint therapy, alternated with 2 MDMA-assisted psychotherapy sessions and 2 post-integrative sessions over the course of 9 weeks. PTSD symptom severity and the quality of the relationship will be assessed pre- and post-treatment. We hope to publish our results in 2 years and contribute to gaining more insights in this new treatment approach.
My name is Dr. Gerda Wesseling. I am a clinical psychologist and co-researcher at the VIBU, the Veteran Intensive Treatment Unit, in Amstelveen, the Netherlands. At the VIBU, we've been pioneering a voluntary 12-week inpatient program for war veterans with PTSD with comorbid personality and/or substance use symptoms. Our clients have attempted multiple treatments before, but without the desired effect. The pioneering that we do is not in the separate treatment interventions that we offer. These are all well-researched and have a sound evidence base. The pioneering is the way in which we simultaneously combine evidence-based trauma therapy with dialectical behavior therapy. Dialectical behavior therapy, also known as DBT, is aimed at increasing life skills learning to take responsibility for change where that is possible, and practicing acceptance where change is not possible. We think this program does not only reduce PTSD and comorbid symptoms, we also think that it helps veterans reduce feelings of helplessness by helping them take charge of their own recovery process. And this is important because within this group of veterans and their loved ones, feelings of helplessness are often profound, as well as a sense of not being in control of their own treatment and recovery process. That is why self-efficacy is the main focus of our research, which has been awarded funding by the LZV, the Dutch National Veteran Care Institute. We will be collecting quantitative data through well-validated and reliable measures on the effect of our treatment program on self-efficacy, PTSD symptoms, and comorbid symptoms. And we'll collect these data before, during, and after our treatment program, and at follow-up at 3 and 6 months. We also aim to collect qualitative data from both clients and staff. We're also interested in whether our program reduces feelings of powerlessness, fatigue, and stress in our staff. Our war veterans have within them a great capacity for change, adjustment, and learning. To contribute to unlocking the veterans' potential to create a life worth living is an extremely meaningful and worthwhile undertaking, which can cause a ripple effect from the veteran to their loved ones, to their community, and to our society as a whole. We hope and believe that our research will contribute to this positive ripple effect. Thank you.
Hello, my name is Lieutenant Colonel Alex Kumar. I'm a consultant in anaesthesia and pain management in the British Army and also a PhD research fellow with the Pain Research Group at Imperial College in London. I would like to spend the next few minutes describing my PhD research project titled Chronic Neuropathic Pain After Combat Trauma, or CONTACT for short. Combat trauma results in significant mortality or morbidity from mechanisms of injury which are rarely present in the civilian environment. Blast injury and penetrating trauma lead to widespread anatomical disruption and tissue damage, which inevitably includes nerve injury. The signature injury of recent conflicts in Afghanistan and Iraq being single or multiple limb amputations secondary to improvised explosive devices. Modern advances in battlefield medicine and trauma resuscitation have led to the emergence of a group of unexpected survivors who would have previously succumbed to these wounds. These military personnel are predominantly fit young men with a biopsychosocial profile different to the civilian trauma population, and they will have to bear the consequences of these life-changing injuries for the majority of their adult lives. Chronic pain and chronic neuropathic pain as a consequence of nerve injury is particularly challenging to manage and can have a large impact on rehabilitation and an individual's quality of life. In US military personnel, a polytrauma triad of pain, post-traumatic stress disorder, and mild traumatic brain injury has been identified. This is also associated with a high risk of opioid misuse. The Armed Services Trauma Rehabilitation Outcome Study, or ADVANCE, is investigating the long-term physical and psychosocial outcomes of battlefield casualties from the UK Armed Forces following deployment to Iraq or Afghanistan between 2003 and 2014. 600 injured participants have been recruited and matched with non-injured controls. These participants are followed up at 3-year intervals at the Defence Medical Rehabilitation Centre at Stanford Hall. CONTACT aims to describe and evaluate the prevalence of chronic pain in advance and then further investigate participants identified with neuropathic pain. To this end, we have placed validated pain outcome tools into the advanced assessment package, including the brief pain inventory, pain catastrophizing scale, and the Dollar Neuropathic 4 score to screen for neuropathic pain. These pain assessment tools will be evaluated in context with other holistic measures, such as the PHQ-9, the EQ5D, and the sleep index to build a biopsychosocial picture of chronic pain within the cohort. Secondary objectives include establishing whether there is a relationship between MTBI, PTSD, and pain as reflected in previous US studies, and also whether there is an impact of interventions such as regional anesthesia on the likelihood of developing chronic pain after combat injury. This research is novel, it's important, and has direct clinical relevance to the management of combat trauma patients in the future. Thank you for listening.
Welcome to our presentation on inferring mental well-being based on smartphone data. Even though the majority of Dutch veterans look back positively on their missions, still 1 in 5 veterans experience mental health problems. In addition, reality has taught us that it can take several years before veterans seek professional help, making this a serious problem. Our goal is to provide real-time insight regarding the mental well-being of veterans and to reduce the time it takes to seek help. Our platform, Unit Victor, is already available on Android and iPhone and allows Dutch veterans to have their own profile, find and interact with other veterans, read relevant news articles, and receive information about upcoming events. Our next step is developing a self-learning module that monitors users' mental well-being based on smartphone data and signals the user when a change in well-being is detected. To test the feasibility of such a module, we are setting up the following pilot study amongst 30 Unit Victor users. The objective of the study is to explore whether we can accurately infer users' mood, physical activity, social interaction, and sleep based on a continuous stream of smartphone data. Collected smartphone data includes GPS, accelerometer, call log, device usage, light sensor, and screen on-off events. For privacy reasons, sensitive data is encrypted and stored anonymously. Each day, participants are asked to rate their mood, physical activity, social interaction, and sleep on a scale from 1 to 10. These questions will act as the ground truth data for our algorithms. Since people use their smartphone differently, the predictive algorithms will be constructed on an individual basis. The duration of the data collection period will be 6 weeks and is planned to start in July. To test the waters, we simulated smartphone data representing an example user. The results for mood are shown in the graph. The blue line represents the actual mood scores as recorded via the daily questions. The orange line represents the daily mood scores predicted by the algorithm using a random forest regression. As one can see, the actual and the predicted mood scores are very close together, which is indeed promising, and it would be interesting to see if we can achieve similar results with our upcoming pilot study. If you have questions or want more information about our research, feel free to contact me at joost@stichtingunitVictor.nl.
Yeah, all of these are examples of prime research, innovative research into warrior care and how to improve it, of course. We've heard examples in the last 3 about inpatient or clinical treatment programs, about neuropathic pain treatments, and about Unit Victor. After this, we have had 9 pitches. That means that there's only 1 left. And I'll tell you briefly how we're going to deal with this. Now that we have an online celebration of the not top 10, but top 1, it's thanks to our jury, who consists of the retired Colonel Gerald Kerr from Ireland, from whom we've heard before. And you also know Group Captain Alex Bennett by now from the UK, and from the US, Professor and retired Colonel Carl Castro. They have determined that after considerable consideration, that the winner of the Warrior Care pitch contest is...
Hello, I'm Nancy van Velen and I would like to introduce you to my study, which I'm doing together with Professor Van Metten and Dr. Nijdam. So, what is the problem that we are trying to solve? Post-traumatic stress disorder is a major health burden for patients and their families, and it is also an economic burden for society. And you might ask, but we already have evidence-based treatment options for PTSD, right? And that is true. But up to 2/3 of the patients, and especially patients with work-related PTSD, do not benefit sufficiently from these treatment options. So what is our solution? Maybe you heard of 3MDR? That is short for Multimodular Motion Assistant Memory Desensitization and Reconsolidation. So you see why we choose for an abbreviation. And what is so special about this treatment? Well, it is a novel treatment, and I think it has 3 interesting aspects. 1, the patient is walking on a treadmill during the therapy. 2, while they are walking, they are looking at a virtual environment that is displayed on the monitors in front of them. And 3, in that virtual environment, they will be exposed to their self-selected pictures and music that are associated with the traumatas. So that is 3MDR in a nutshell, and the results so far are very promising. In a previous study with veterans with treatment-resistant PTSD, 3MDR showed a clinical significant reduction of PTSD symptoms in 45% of the participants. So the results in veterans are promising, but who else will benefit from it? In our current study, we are including patients who are treatment naive, and they all have work-related PTSD. So not only veterans, but also active military personnel, police, and train drivers. And what's our plan of action? Our current study is a randomized controlled trial where we will compare 3MDR to care as usual. In the care as usual condition, patients will be treated with evidence-based trauma-focused psychotherapy. Our hypothesis is that 3MDR will lead to a faster and greater PTSD symptom decline and an increased health-related quality of life as compared to the care as usual condition. Thereby, we will perform a cost-effectiveness analysis of the 3MDR compared to the care as usual condition. Thank you very much.
And there she is, the winner of the Warrior Care pitch contest with her concept of 3MDR. Nancy van Velen.
Yeah, we give a
Hello.
round of applause.
Thank you.
Yes, this concerns your PhD research in Leiden, isn't it? And the RQ Center for 45 for Psychotrauma. And of course, your first initial reaction.
I'm very honored because I'm very relatively new to the field. So I really like to thank my promoter, Professor Dr. Van Metten, and Dr. Nijdam, who's my co-promoter. And I have also some good news to share because we already have included 100 participants to our study. And that is, of course, thanks to Leiden University Medical Center, ARC Centrum 45, GGZ Drenthe, that's the Mental Health Institute, and the Dutch Military Mental Health Institute. So, yeah, it's very great.
So those are 100 people walking on those treadmills, having the VR experience.
Yeah, that's true. And I hope that at the end of 2021, we will have completed our inclusions.
Yeah, well, now that you have the floor, what is your appeal? What would you like to share with the world now that you've been honored with this prize? You can say whatever you like.
Well, I think that 3MDR is a very novel and great new treatment opportunity because it's so different from the more traditional, if I might say, psychotrauma therapies. Like it's the same as Skip Rizzo said. I think the combination of virtual reality and integrated into your treatment, it's wonderful, and I think it's very helpful for the patients as well.
Yeah, thank you very much for helping those patients by doing your research. And that was what this pitch contest was all about, to find innovations in recent research. And yours was one prime example, that's for sure. Thank you very much, Nancy van Velen.
Thank you.